Here we go. It is August. The leaves leaves aren't changing yet, are they? No. The weather is changing because it's cold in the morning and then it's like super hot in the evening. But we are still thankful and blessed to do the things that we are able to do in this community. So if you've not been to one of our meetings before, I want to let you know that we do start out with a prayer or meditation. We are a faith-based agency. However, if that's not your thing, please feel free to close your eyes or listen to music silently or turn off your camera and come back in about 1 minute. This morning, I wanted to do a meditation about letting go. I'm one of those people who likes to hang on to a lot of things, who likes to do a lot of things. But sometimes it's better to let go, okay? And so this is a meditation by Thomas Rhodes I wanted to share with you all. So if we can just take this time and just be silent and quiet and still from all the things that were happening this morning and all that's going to happen this afternoon. Let us enter into a time of meditation and contemplation, and for some of us, prayer. Feel the earth beneath your feet as it supports you. Feel the love of this community as it surrounds and enfolds you. Feel your breath as it flows in and out of your body. Listen. Listen to your heartbeat. Listen to your heart. Take another breath and hold it. The air you hold in your body is the most precious thing in the world, for your very life depends on it. And yet, none of us can hold on to it for more than a moment, or else we would strangle and we would die. What is most precious to us must be released. Exhale. It must be released so that we may live and live fully. Look into your heart, find what is there and hold it. The love you hold within your heart is the most precious thing in the world, and yet no one can hold on to it any more than your heart can withhold its blood, or else we would die from loneliness and misery. What is most precious to us must be shared so that we may love and love fully. Look into your life at those things that are most precious to you. Look again. You will find that their value lies not in being held, but in being shared. Life, love, laughter, longing. May we share these precious gifts. And may we share these precious gifts that they may return to us, multiplied beyond measure. Amen. Thank you. Don't we all feel a little more serene and calm now? Knowing that those things that we hold precious are best when we share them and not hold on to them forever. And just knowing what are those things that we hold most precious. Okay. All right. Now that hearts and minds are prepared to receive, I want us first to receive one another. Okay? So we want to do some introductions. Who is here? And I want to start today with introductions online. We usually do people in person, but let's start today with introductions online. Can we do like a full screen of everybody?
Most people have their cameras off, so if anyone doesn't mind turning their cameras on, then they'll come on our big screen.
Oh, I thought we could see them even. I can see them on here.
Yep.
Maybe I can use Colleen's camera here. We got a lot going on today, people, for those who can't see. trying to. All right. So I'm looking at the screen and I'm going to call people off by the names that I see. So first of all, I see Yolanda. Yolanda, would you introduce yourself?
Hi, my name's Yolanda Hemp. I'm deaconess intern at the Shepherd's Hand.
Okay, wonderful. Just say your name and your affiliation, who you're representing today. And then we have Miss Lupita, who's moving around.
Hello, this is Miss Lupita, staff from Calvision Midwest. This is my first time attending to the meeting by video. And it's
Yes.
exciting.
Yes, Lupita is our bilingual community health worker, so she is working from home today. And then we've got Ann from CTN.
Good morning, everyone. Ann Hall from CTN.
Okay, wonderful. CTN, that is the Community Transportation Network. For those who are not familiar with CTN, they do great things in transporting folks around the community. Kelsey.
Thanks, Sharon.
Mm-hmm. Kelsey.
Hi, good morning. I'm Kelsey Owen. I'm over the nutrition programs with aging and in-home services.
Okay, wonderful. That's one of our partners who works with the HEAL program as well, giving seniors fresh produce. I see Joyce is in the house.
Joyce Lothamer, United Healthcare.
Okay, Miss Joyce, she's with United Healthcare. And then I see someone on an iPhone. I'm not sure who that is. There's no name. iPhone person. Okay.
As JJ Foster, I'm JJ Foster from Lake City Bank.
Okay, JJ is in the house today. Wonderful. JJ used to be with Fort Wayne Housing Authority, for those who are unaware. Now he's with Lake City. All right. And then I see Angie. Oh, Angie.
Hi, Angie Zagel with Neighborhood Health.
Okay, Angie. Angie is the CEO there. And then Megan.
Hi, I'm Megan Stites, and I am with CareSource.
All right, Megan. And then Sheila.
Good morning. I'm Sheila Curry Campbell. I'm with Pilgrim Baptist Church. Also serve on the board as the treasurer/secretary. Thank you.
Awesome. And then I'm looking at Carlos.
Hi,
Carlos.
I'm Carlos Harrison with the Indiana Department of Health, and I am a community health worker in charge of a health equity council.
All right. They're putting together a lot of things there with the state. And Nancy.
Nancy Kripe with Tobacco Free Allen County.
All right, Nancy is what is her title there? Director, executive director. She's the top dog. James.
Good morning. I'm James Carroll. I'm the faith-based outreach coordinator for the Indiana Department of Health, Office of Minority Health.
All right. Now, James, is this your first time joining us?
Yes, it is.
All right. James, let's give James a little clap. Okay, we got some state folks here. Thank you. Kathy.
Good morning, everyone. I'm Kathy Thornson, the Director of HIV STD Prevention at the Allen County Department of Health.
Okay, wonderful. Kathy's been here before. Kathy has been here before, yes. Okay. And then, of course, our old friend, Jared.
Hi, Jared Blanchard, Community Wellness Coordinator for Purdue Extension in Allen County.
Awesome, Jared. Was there anybody else online who hadn't been here before? I think everybody else had. Am I missing someone? Okay, all right, so no newbies there. So welcome, welcome, welcome. Now we're gonna go through introductions in the room, okay? Colleen, we'll get to you later.
Okay.
All right, here we go. Heather.
My name is Heather Essex Guy. I'm the Racial Justice Coordinator for the YWCA.
Doing great things with their racism series, okay? What's the next one coming up?
The next one is November 17th. It'll be over thankfulness and diversity.
Okay, awesome. All right, Jan.
I'm Jan Moore from Parkview Community Nursing.
All righty, wonderful. And we've got two newbies here.
I'm Anna Calamine, and I am with the Allen County Public Library.
All righty.
I'm Meg Bell. I'm with the Allen County Public Library as well.
Okay, we are just pleased as punch to have the library involved in our health equity meetings. We love that. And then we've got our old friend here.
Brenda Hoffman, and I am with the Christian Community Healthcare Free Clinic in Grayville, Indiana.
All right, so it is your first time in the room, but not your first time in our meeting.
Right.
Excellent. And then we've got, you came for the first time to the office, right?
To the office, yes.
Yes,
Yes.
yeah.
I've been on your screen before.
Yes, you have. I've noticed, yes.
I'm Jeff Markley. I'm the director of the Northeast Indiana Positive Resource Connection. We're an HIV/AIDS and hepatitis C service organization.
Wonderful.
I'm Carrie Greiger with Great Heights ABA.
Okay.
Cassius Stallings with Health Vision Midwest Fort Wayne.
All right.
I'm Danielle Furge. I'm the nurse educator at SuperShot.
Have you been here? Okay, Danielle's first time. Don't try to sneak in. All right. Wonderful to have you here.
I'm Julie Reese, and I'm with Journey Beside Mothers, which is a mother mentoring ministry with Associated Churches.
Okay, wonderful. And this is your first
time in
okay.
here, but I was to the library last year.
You were at the meeting with Zach Benedict.
Yeah.
Okay, well, this is your first time in this traditional meeting, so we can give you a All right, and
Yeah, I'm Stacy. I'm also a super shot. I sat in the wrong order from Danielle, but I did want to introduce Danielle. Danielle's going to be our new nurse educator, which is not a new position to super shot. We had one kind of before COVID, and we're getting back around to, we really are focusing on that community education piece. So that's going to be part of her role, is specifically how do we reach specific populations that have different barriers to vaccine services.
okay, we've been doing a lot of work with SuperShot. We've got some clinics coming up. We'll talk about those later. And here we are with.
Hi, I'm Felicia Say, and I'm with Health Visions.
All right, Felicia is our backbone, especially when it comes to technology and these types of things. All right, so, and then we've got Miss Peggy, come on in and introduce yourself.
Come on in. Peggy Hayes, Health Vision Fort Wayne.
All righty, awesome. So we've got all those introductions out of the way. We can see who's in the room. We've got some great folks here, people with a heart for serving, organizations that have been serving, some for a long time, some that have been serving for a short time, some doing some new things, people in different roles. So it's great to be connected and to be collaborating with these people in various roles. So you can look around the room, you can look online, and you can see people that you can work with in your organization. If you're sitting back in your office and you're thinking, okay, well, who can I get to help with this particular event? Or how can I reach this particular audience? Look no further than this room. And this room, this virtual room as well. All right, so without further ado, we want to get into our talk today, which is going to be an awesome talk. I want to introduce Colleen Carpenter. Anybody, how many people know Colleen in the room? Okay, we've got just a very few showing of hands. Not sure about online, but a lot of people don't know what you do. And we need to know what Colleen does. Colleen Carpenter provides these evidence-based training and targeted consultation services, and she does this to build long-term capacity to prevent suicide, okay? This is a very serious topic, and we thought it would be great to bring Colleen in advance of Suicide Awareness Month, which is September, okay? And so some of us aren't aware that suicide is also a health equity issue. It affects people disproportionately if you look at the ethnic groups and the ratios of people who suicide. I had to think about that because there's some new terminology in terms of how we talk about suicide. And she's gonna probably talk about that a little bit. But she is suicide prevention. She's a suicide prevention trainer and consultant and a QPR master trainer, okay? She is the director for Stop Suicide Northeast Indiana. And so without further ado, Colleen, why don't you come on up and talk about the serious issue and how we can help and enlighten us.
Sure.
All right, thanks everybody. I'm going to share my screen and share some slides and probably content I didn't plan on sharing because you're watching me fiddle with things. Okay, so as Sharon mentioned, there are disparities related to who thinks about, attempts, and dies from suicide. And I wanted to dive in not only because Suicide Prevention Month is coming up, but because Stop Suicide is taking, has been focused for the last year on what can we do to prevent Black suicide, because it's on the increase. And so we'll get to that, but I wanted to sort of show you data. So those of you who aren't super data geeks, you might be like, whoa, this is a lot. But I wanted to show you how suicide happens differently depending on age, gender, sexual orientation, race, and ethnicity. So we're going to dive in, and like I said, I mentioned sort of 3 concepts. These are the data points that we look at when we're concerned about suicide prevention. How many people are thinking of seriously considering suicide or having ideation or thoughts about suicide? How many are attempting suicide but thankfully living? And that's really hard to track because a lot of folks who attempt suicide don't go to an ER or call their doctor after they've attempted. They go on with their the next day, right, and don't tell anyone. So that's a bit of a hard one to track. And then how many die from suicide, which is also hard to track because, as you might imagine, things like overdoses and single car accidents, it's not totally clear if it was an accident or if it was intentional. And the intentionality has to be there in order for something to be ruled as suicide. And the self-inflicted and intentional, those are the 2 qualities that have to be very clear after a death for someone, for a coroner or a medical examiner to rule it as suicide. So we're going to look at these 3 data points, and it might get a little confusing because we have some data right at the county level. So we have some good Allen County data, and then sometimes we have to rely on state level data. And all of you who are focused on your little niche probably have that same conundrum, right? How much local data can we really get for the topic we're interested in, and how much do we have to rely on state level data? So let's look at gender and sex. You all may know, and this is death data, so you'll hear me really emphasize what data we're looking at. In terms of deaths, you may know that men are about 3.7 times more likely to die from suicide than women, and a large part because men are more likely to grab onto guns, which are very fatal, and women are likely to use a different method that doesn't necessarily have the same fatality rate. So that's always been there, and Indiana is no different than the national level. Women have been staying steady in Allen County with their suicide deaths, and men in the last year have been coming down a little bit, but they're always higher. This is a lot of data. This is survey data of high school youth, and you can see the grades are actually highlighted by the different colors. And what you'll notice here, and what I'd like to point you to, is the first line is how have they felt sad and hopeless for 2 weeks or longer that they just gave up on their normal activities, which is a classic definition for depression, right? So this is depression, this is suicide thoughts, and this is suicide attempts. And what I want you to notice is the female bars are higher for depression. So females are more likely to face depression. And if you look at the grades, 11th grade, 10th grade, 11th grade are the highest depressive times. For suicide thoughts, again, female bars are higher than male bars, right? So females are more likely to think about suicide. And then these are high school youth in Indiana. Then in terms of actual attempts, this is a youth on a survey saying, I attempted in the last year 1 or even more times than 1. Again, female bars are higher than males. Although you could see that the male's highest is in freshman year, and the female's lowest is in junior year, and they're relatively close, actually. So, but in general, females tend to feel more depression in high school, think about suicide, and attempt suicide more often than the boys. But this was supposed to be deleted, so just ignore that. Okay, let's look at sexual orientation. And sexual orientation is something that we haven't tracked until recently in Indiana. These are not Allen County data, they're state of Indiana data. And what you see here is for depression, gay, lesbian, or bisexual youth, these again are high school youth in Indiana, 80% of them had faced depression in the last year for 2 weeks or longer. 65% had thought about suicide, and 22.5% said that they had actually attempted suicide. So again, compared to their straight counterparts, right, there's a lot more risk for depression, suicide thoughts, and attempts. And that is largely due to discrimination, victimization, stigma, internalized, discrimination, self-discrimination. So it's the way in which they're treated. It's not something organic to being gay or lesbian. It's the context in which they're living. And in fact, what they found is when parents reject youth and their sexuality, they are 8 times more likely to make a suicide attempt. So when there's parental rejection, suicide risk goes way up, which kind of makes sense, right? I mean, it's like complete rejection, which is incredibly hard to face. So let's look at age. And age, this is a wild graph, but what I want to show you is that these are deaths. So we're switching from depression, thoughts, and attempts to deaths, and this is in Allen County. What you notice in Allen County are the younger ages, especially the 30s, 40s, and 50s, 30, 40, 50s. And I wanted to point out the increases. So the red line is 20 to 24. That's been increasing lately. Here's the 45 to 60, 54. They're increasing. The biggest increase came in the 25 to 34-year-old, which kind of makes sense, right? Like, that's when we're trying to figure life out. We don't know who we are and what we want to be, and it's, sometimes you go off to college because your parents expect you to go, and you're not even sure what you're doing there. So, I mean, it can be a really hard time to figure out who we are and where we're going in our 20s and 30s, but they've had a big increase. In general, it's typically, if you look at rates, it's the oldest white males who die by suicide. But in our county, that is not necessarily true. So I just wanted to point out the age in terms of death. So one thing I wanted to point out back there, is although young people face depression, think about suicide, and attempt suicide, notice they're the yellow line. They are not the highest in terms of the 10 to 14 year olds are the yellow line, and then this lime green line is the 15 to 19-year-olds. They're not the highest group to die from suicide, thankfully. And I think part of that is they don't have access to guns, or at least you hope they don't, right? And they may not know what a lethal dose of medicine is. So they may think, I'm taking 6 ibuprofen, I'm done. And we're like, God, I take that when I sprain my ankle, right? So thankfully they don't know what lethal is, or they may not have access to it. They may not realize their dad's on heart medicine and they could have reached in to take something that could have really ended their life, right? So thankfully our youth are not dying from suicide as often as older folks, but they are really struggling with depression, suicide thoughts, and attempts. So I just wanted to point that out. This is kind of a busy slide, but here are those questions: the felt sad or hopeless for 2 weeks, so the depression question, the serious thoughts of suicide, the plan to attempt suicide, which I have not been showing you because I figured I'm already showing you a lot of data, and then actual attempts. And what we found in Indiana are these percentages, and they're highest among high school youth. This is what scares me, is half of high school youth. If you round it up, it's 47%. It's virtually half of high school youth in 2021 said that they had depression in the last year. It's never been that high in Indiana, never. 25 maybe %, and we've almost doubled it. Part of that's COVID, right? We had COVID happen.
Can't be their friends.
What's that?
Can't be their friends.
Yeah.
School activities, that kind of thing.
All that isolation and identity and maybe negative home environments, and they're spending more time at home. But what's really interesting is when you start looking at adults. Look at this. From depression as a high schooler this is 18 and over. So this, to be fair, this is 18 all the way up to when we die, which could be in our 80s. That's an average. So what I chose to show you was, what if we looked at 18 to 25? Because we know, look, it is higher than just the overall adult average. In our 20s, well, in our late teens and early 20s, we do have higher rates of depression and suicide thoughts and attempts. So I just wanted to point out that age difference, and I will share these slides. I'd be happy to. I wanted to start getting into looking at race. And this slide is out of order, but that's okay. We're going with it. We asked for data specific to Allen County by race for the Indiana Youth Survey. And the Indiana Youth Survey is usually focused on substance use and what substances they've used in the past year. But they asked 3 questions that are related to mental health, basically. The depression question that I mentioned, thoughts of suicide, and if they've made a plan to attempt suicide. And so they call that mentally distressed if you've answered one of those 3 questions: depression, thoughts of suicide, or a plan for suicide. And I asked them to break it into middle and high school because I wanted to be able to see it. So I wanted to show you how many white versus black versus Latino versus other, middle versus high school, answered yes to one of those 3 questions and therefore are considered mentally distressed. Pretty high, right? That's not good. Adults would look differently, for sure, if we looked at it. And for African Americans, look at that. There's a definitely, and actually for all of them, except for, I don't know if the Latinos is statistically significant because the change is it's small, but still, more distress in high school. It makes sense to me. I mean, there's a lot more rigor. There's a lot more pressure of like, what am I going to do after high school? It's harder. It's tough stuff. So that slide should have been before. Let's look at depression, suicide thoughts, and suicide attempts by race. What you will notice is the multiracial category. And this makes a lot of sense too, right? Because you don't fit in one category, you don't fit in another, right? You're kind of strapped, am I half white? Am I white because I'm half white? Am I black because I'm half black? Do I fit in anywhere? And it can be hard to be identifying as multiracial. So look at thoughts of suicide, way higher amongst this. Again, these are high school students identifying as multiracial, way higher. Suicide attempts, way higher. And for me as a prevention-oriented person, how do we target multiracial groups, right? I mean, it's not like we have after-school programs or support groups for those who identify as multiracial, right? But I think that is, it fits with the narratives I hear for people in my life who are multiracial. I have one drop African American, so I'm African American, but I don't really, I'm not considered black with my black friends. I'm considered biracial. So I just want to point that out. And there is an economic piece that I found in the United Way survey about why people don't seek help when they're struggling with mental health. And the biggest concern was cost. So there's an economic disparity there as well. So for those of us who are struggling with mental health challenges, do we access it equally? No, we don't. And one of the reasons we don't is economics, because there's a cost barrier involved. We don't know if our insurance is going to cover it, or we've met the number of, sessions that my provider allows, or my insurance will cover, I should say. But I wanted to go back to race, because that's really been my focus for the last year. And I wanted to point out there is a national level concern about Black youth and suicide. And it started, it's been going on for years, but at the national level in New Jersey, there was a representative that said, we need to be talking about this. We need to convene mental health experts and talk about this. So they convened a panel in 2018, and the Congressional Black Caucus created an emergency task force who studied the issue, and they came out with this report, Ring the Alarm. And the subtitle is The Crisis of Black Youth Suicide in America. And this report is really powerful. I'm happy to send it along to Sharon to share. And they said that the suicide death rate among Black youth has been found to be increasing faster than any other group, a racial and ethnic group in the nation, and that is true. That has been true for several years. And this was really startling at the national level too, is when we look at the youngest youth in our nation, that under the age of 13, Black youth are twice as likely to die from suicide as white youth when we're looking at the younger youth. This is at the national level. And that really caught our eye. So DMHA, the Division of Mental Health and Addiction, helped us really tease out race as we started looking at race and suicide. The blue line is Black or African American suicide, and it has increased over the last few years. And while the white suicide rate is starting to level off, Black suicide rates in Indiana are continuing to increase, as is Latino increase. And I have a better slide to look at that in a couple of slides. But still, let's look at Indiana compared to the US. We are the blue line. Black suicide in Indiana is the blue line. Black suicide in the US is the red line. We definitely have more Black suicide in Indiana on average than the red line, which is the US. And if you look at the visits to the emergency department for suicide attempts, I think is it just self-harm? Yeah, it's not suicide ideation, it's suicide attempts. Yes, there are more visits of white people to the emergency room because there are more white people in general. But if you break it down to a rate per 100,000, what you'll see is the rate of Black people going to the emergency department for suicide attempts is higher than white people. So Blacks are visiting in Indiana, the emergency department for attempts than whites are. They have a higher rate. That is definitely concerning. And then when they looked at county by county, guess who had the highest Black suicide rate? Yeah, we do. Followed by Madison and then St. Joe County where South Bend is. Yeah, so, and then Vanderburgh, which is where Evansville is. But yeah, we did a better graphing of this, I think. So here are white, Black, Latino, and Asian. The dark gray line right here, I tried to point it out for you, is the Black suicide rate in Allen County. These are coroner data. And so I made a little box here, and you can see that if we compare ourselves to the nation and the state, if you look at Black suicide rates, Allen County is 15.5. I've been in this field since 2004. I have never seen a Black suicide rate above 8 or 9. So 15.5 compared to 7 for the nation and 8.9 for the state. So we definitely have an issue with Black suicide in our county. And I'm definitely concerned about it. The last data point, I think this is the last data point because I know you guys are like, this is a lot of data. I wanted to share is if we look at youth, high school youth in Indiana, this is not Allen County, who said they actually attempted suicide, Black youth in high school outnumbered Latino and whites for having actually had a suicide attempt. This is an Indiana survey. So again, this is something we need to be looking at. So a group of us said we need to do something about this. A group of us, which I will send, I'll show you the list in a minute, got together and decided we should have a youth engagement project. So we want to engage with youth in Allen County, Black youth, and understand what's going on. What is underlying the distress? What's underlying turning towards suicide and suicide thoughts? Because obviously I'm white and middle-aged. I have no idea. I can guess. Racism is for sure tied, but I mean, that's my perceptions are not reality. Their perceptions are reality. So engaging youth to better understand why it's happening, and then work with youth side by side, a youth engagement project to design strategies to raise awareness, to reduce stigma and shame about getting help, and then promote help seeking among their Black peers. Getting help is a sign of strength and a sign of courage, not a sign of weakness, right? But that raises the conundrum of, mental health services have been designed by white people in buildings that people of color may have never entered into, and going to someone you don't know in a building you've never been and airing what you consider your family's dirty laundry is not necessarily acceptable. So our mental health strategies that we've had for the mainstream white community aren't necessarily appealing to or effective for people of color. So we need to figure out what is it that would help, what would be acceptable. And so we want to be able to make recommendations for those in mental health care of what would be acceptable and effective, but maybe we need to rework the whole way in which we look at and help people when they're having a mental health crisis. So what we've done is we've done step one. We've written a grant to the Together We Will Fund. It's me building Stronger Families and the Children's Health Collaborative and a wonderful researcher, Tanisha Riley at IU. We wrote this grant together. Once we get approval, which we should hear any day now, that's when we're going to get involved with the youth. The youth are going to help us design surveys and focus groups to better understand why this is happening. The youth will then help us lead a community symposium to then engage adults and also educate and gather more input, and then work on developing strategies. But we'll need a different grant for the strategies piece because the grant's limited to $75,000, so that'll probably only get us step 2 and 3. So we created a flyer talking about the fact that 1 in 4 youth said they had seriously thought about suicide in Indiana, to get youth together, and we'll be pushing that out soon. But here's a list of folks, and this is not even updated, who said, hey, I want to be at the table for this. So I don't know if you guys know Don LeRae at Fort Wayne Community Schools, Natasha Andrews, Cherie Reason, Cameron Shackelford, I think you guys know him, Prentice Moore. So, and more. Like, I have a very long list of folks. You know, Cassius and I had coffee and he's like, oh, this sounds amazing. Yes, I want to help in any way I can. So if you all have ideas or are really pumped about this or want to fund this, which I think a lot of us in the room are like seeking funds ourselves, but JJ, Lake City Bank, no.
Collaboration.
Yeah, collaboration, right? So yeah, please, like, contact me if you are moved by this, you know people who are interested in this. We have got to figure this out. We're writing, actually Dr. Tanisha Riley is writing a National Institute of Mental Health grant to try and get like a much bigger study going about why this is happening and what we can do about it. So thank you for listening. I hope that wasn't too much data. I'll be happy to get my slides in the right order and then share them with Sharon and get them out to you all.
Questions?
Yeah, questions.
I don't have a question, I have a comment, but before COVID, when as a community nurse, when we were out in the community at health fairs and different things, and we would have information on our table, mental health in the Black community flyers flew off of our table.
Wow.
Flew, and
That's
we had
great.
noticed that, so we tried to provide more and more for each of the health fairs we would go to. So not really surprising, I guess.
I love that, and I do feel like there is a sea change happening in the Black community wanting more information. We just held, and Cassius came to this, we held a Soul Shop for Black Churches training in July, and it's suicide prevention for Black churches. It was such a powerful training. We're gonna bring the trainer back. She was in Chicago, but we're bringing her back next year. But yeah, there is an openness.
Yeah.
And especially among youth, right?
Yes, and I
The
feel
youth are
like
knocking down that
they're
stigma left and
looking
right.
for that. They're thirsty for that information. How can I be helped?
Yeah, yeah, that's awesome.
So I like that you named the fact that within Black culture, the stigmas are being decreased. But I think what some of the numbers are also pointing at, and I can recognize it, especially here in Allen County, is that we actually don't necessarily have community that are open to receiving us. So I'll give you an example. Yesterday I was in a place where nonprofits acknowledge that there's a disparity and an access gap to their services, and the kind of like reception to that qualitative data, that quantitative data, it was numbers that said it, was like, huh. But like, this is a problem that persists and it's getting worse. And if our Black youth don't feel necessarily welcomed into larger community spaces, right? So I think that contributes. So I think it's more than just reaching out to our Black youth and telling them that there are these things. We have to make sure that we have community supports ready to receive through this transitional time. So I wonder if there's ways in which that could be a part of your work as well.
I love that. I love that. And getting youth to think about what would that look like? What do they feel we need to do as adult service providers to welcome them? What needs to shift? What does welcome look like for them? Because you're right. I mean, that's been a problem for decades in this community, and it still is.
I think my thing is that it's not necessarily work that the youth have to do. I think the community has to do the work to receive these children.
I agree. But what is, I mean, because I think about what welcome looks like, and it might be different than what they, but I agree, you're right. And that, I think, yeah, we need to, thank you, I will write that down.
I say it whenever I can.
Yes, no, thank you, and keep saying it, seriously. Yeah.
You do have a question online. Sheila Curry Campbell, if you want to come off mute to ask your question.
Thank you so much. This was an awesome presentation. I think one of my concerns is, or my question, I know you say that biracial has the highest category, but when you come back and spin it around, you have the category as Black. So what percentage in the Black is that of biracial? Because the slides didn't reflect the biracial. The ending was Black. And once again, it was your presentation. How do you translate that? Biracial out of Black? Thank you.
Yeah, that is a great question. So at the state level, the youth survey, well, actually it's a national survey at the Centers for Disease Control that we implement in our state, as do many states. And they were, I think, forward-thinking enough to have a multiracial category. We do not have that forward-thinking on the other survey, that, or at least that I can tell. I put the question in, Sheila, to the Indiana Youth Survey, which is a substance use prevention survey. They gave us other, and then Latino and Black and white. And so what does other mean? So I've emailed them and said, what does other mean? And if a multiracial or biracial is in there, can you separate that out for me? Because I want to see at the county level if that multiracial trend that we see at the state level still holds. So that's a great question. It's partly a limitation of the way people collect data, and I'm not in control of that. But am I answering your question?
No, you're not, but that's okay.
Well,
I think sometimes it's data can do whatever you want it to do. And one of the things that I see when I'm in these rooms is that unconscious bias where you don't realize what you said and what you showed. So you said that biracial was the highest category, but you showed Black. Thank you.
Oh, so on that slide is what you're saying, that I actually pointed out. Let's find that. Because the later slides didn't have a multiracial category. So this slide is the multiracial being way higher, right? This is not as high. I mean, the disparity here in depression is not as great, but among thoughts of suicide and suicide attempts, the multiracial category is twice as high. This is almost almost three times as high multiracial than Black for thoughts of suicide, and not quite half as high as much for, or twice as much for suicide attempts. So I think that's what you're talking about, Sheila, or maybe it's me saying biracial, multiracial.
Yeah, Colleen, I think that's clear. You talked about how there are some different surveys and data is collected differently at the national level than at the state and the local level. So I think we kind of see it. You've made the request for those figures to be broken down when it actually comes to the ratio of death. That's the last slide you were talking about.
Because we have Black, white, other. I'm like, well, where's multiracial? Is it in the other? And that's what I'd like to find out.
And so hopefully we can find out that information so that we can have some congruent data of including the multiracial death rate
Right, for Allen County, because we have
Yeah.
good state, this is state, you know, are we
Right.
going to assume that Allen is like the state? Probably, but
Right.
I'd like to know.
I have a question.
Yeah.
So in the slide where you were talking about the Black rate of death being higher, with the 15.5 being almost double, is
Yeah.
that what I'm thinking? Yeah.
Yeah.
Being
Yeah.
almost double of the state. Do you have any information in that death rate as regarding the age? Are those younger folks?
That's a great question. I will get you that data. I did not put it on here. It depends on what year we're talking, honestly. Some years, like 2020, was not a good year for Black youth in our community. We had several suicides, actually. I remember 2 of them at my kids' school of Black youth, middle school. So it really depends on the year, whether we have youth represented in those young youth or not. So I'll get those to you. That's a great question.
And are there other efforts going on to address this situation in this community?
Not that I know of, but please speak up if that is the case. That would be amazing. I would love partners.
To what extent have you shared with like the community or the school systems?
I haven't, but that's a really good idea too. Yeah. Yeah, that's a really good idea. I'm trying to think of how to do that. Maybe a principals meeting?
Superintendent first, maybe the principal's meeting.
Start with
Or
administration,
even,
then special.
school nurses see those kids a lot.
Yeah, good
So
point.
then with Mary Hess's school nurse
Yeah,
meeting.
yeah, Mary has, yeah, definitely. Okay, great ideas, yeah. Yeah, please, more, bring on the ideas.
Because all of the school nurses have had to keep their training, so,
Yeah.
you know, if they can talk with a student.
I have a question.
Oh, yeah, definitely.
So you also mentioned obviously a higher rate in LGBTQ plus individuals. Is there any correlation, have you been able to break down in the Black attempts or the Black suicide issues, how many of them identify in the LGBTQ that are kind of multi-pronged issues?
Right. I can ask at the state level if they can break that out. I don't think that the county level data that we have access to, that substance use survey, I don't think they asked about sexual orientation, but I will ask at the state level. I have really good relationship with them and they're very fast. Thank you. That's great. The last plug is Stop Suicide does have these toolkits that are free. We raised a bunch of money from people to print 20,000 of these. And please, like, we want to get these out. They're little kits that you can just pull out. You know, what if I'm worried about someone? How do I ask? Where do I get help? And then this one is after a suicide loss, so immediately after a family's had a loss. But we want our stopsuicidenow.org, we have a form. We want to get these out. You know, ask for them for your workplace, for your church, for your bowling league, or wherever you hang out. You can use these and offer these. So, yeah.
Awesome, thank you, Colleen. Yes.
And I didn't plug Cassius, but you're gonna plug
Yes.
Cassius, yeah.
So in our follow-up email, we will be sending out the link or the website where people can ask for some more of those Finding Hope brochures, those kits for folks. This is an awesome presentation because I think many of us were enlightened with that data. So it was not too much data. It was good data. But one thing we obviously need to do is we need to get some more surveys, some more comprehensive surveys in the county so that we can parse out some of this information and get down to what's really going on. I don't know how we do that, but maybe who's getting these surveys out here that's not breaking down the information in terms of.
Yeah, that's a good point. Maybe.
Yeah.
Okay.
Yeah.
I'll ask the Indiana Youth Survey folks. Okay.
Yeah, so maybe that's a way to start so that we can have some of that information that's parallel to what's going on in the state and the nation. All right.
May I say something, Sharon? I do apologize.
What?
May I ask a question, please, or make a recommendation, please?
Okay, real quick. Come on, Miss Sheila.
Real quick. Yeah, I mean, we have a lot of folks on this call in these meetings. I think cross-referencing some of this data is a place to start. I think multiracial, that really kind of bothered me. And so I think we need to cross-reference with some of the other agencies and their data, please, and thank you.
Okay. cross-reference, she dropped her mic there, that was a mic drop, with some other agencies. So with, Sheila, you mean other agencies what agencies should we be cross-referencing with? Do you have any idea now, or?
In the introduction, I heard quite a few folks that was on here. I mean, you got the state, you have Department of Health, you have several agencies that collect data and use data with their services.
Okay, so maybe check and see if some of those agencies have the information broken down that the youth survey that you were looking at perhaps does
That is
not.
correct. Or we could create our own data. Like you say, who is actually receiving these surveys? I'm working with Mr. Phillips. We're having an event in October at Pilgrim. We have a nonprofit, Pilgrim Progress Community Development Corp. And so that is one of the programs that we're going to have. I would love to talk to your speaker later. I don't want to take up much time. Thank you.
All right. Passionate topic, good topic for us all to think about and look at, a very important topic. All right, so we do have some announcements that we want to make as we move on with our agenda. Colleen alluded to this. Cassius, can you talk a little bit about shattering the silence? So this is just the beginning of this issue that we're tackling at Health Visions. Cassius? You don't, is he on
yeah, if you want to come up here, but just be careful for all these wires. And I can actually put it on the screen too.
Okay.
Yeah, that'd be appreciated. I'll show you guys in a minute. So, excuse me, sorry, I just want to be in focus. Okay. So yeah, so thank you again, Colleen, for that presentation and the statistics surrounding suicide. As many of you kind of already said, and for me personally as well, we don't know that these things are happening. We don't know that this is going on. And so we are happy to have this Aspire at the end of the month, August 31st. And we're titling it, it's titled Shattering the Silence, because we have to shatter the silence surrounding these topics. As it pertains to us men, it's particularly, since Colleen shared that it was 3.7% higher for a man to die by suicide than a woman. And that just doesn't sit well with us, any of us hearing those statistics. And so we're going to have Colleen, she's going to come on again and share those statistics again, but we're not going to leave the conversation with just the data. We've asked Pastor King to come on there, Pastor Lewis King, and to, give us a conversation of hope, to give us some hope around these topics and continue to remind us, man, the resilience that we have in us, to combat this issue. It's going to be on the 31st at noon. There's a QR code. If you would like to join, please share this. This, I think, is a good plug, again, for us to get this information out there so folks are aware of this. So thank you.
Awesome. Thank you, Cassius. So as he said, Lewis King is the author of a book called The Reinvented Man, and so he's going to have some very inspiring words to talk about. He's also a local minister. And then in September, following that up, we will have a virtual QPR session. So people can log on virtually and get the QPR training. That stands for Question, Persuade, Refer. Question, Persuade, Persuade, and Refer. So it talks about, of course, how to communicate with someone who might have suicidal ideation, right? And then Colleen does those trainings in person. So if you want to have, some of that QPR training at your workplace or something like that, contact her for that as well. As I said, she is a master QPR trainer. So we've got all that going on. Also, we want to let you know about our ongoing Heal Farm markets that are Wednesdays and Thursdays and Saturdays, where we have the opportunity to double WIC, SNAP, and senior produce vouchers, and that's at McCormick Place. That is at the Parkview Greenhouse and Southside Market. So people that you know who are who benefit from those programs, please let them know about this. Anybody, however, can go to the market. It's a wonderful program. We have local farmers who are invested in this. local farmers, some of them Burmese, and they make their living off of these markets. So this is really enhancing their family income. Please participate. On Thursdays, second and fourth Thursday, we have Thriving Thursdays here at Health Visions Midwest. Our own Sister Peggy here is the training. Sister Peggy. See, that was prophetic or something.
You are just
Reverend Peggy. Inside joke. But Peggy will be doing some things. What are your topics for September?
I'm looking at some different things.
She's looking at some different things. It'll be good. It'll be great.
Yes.
You'll get that information through our news and events posts. I hope you all are getting those and paying attention to those. They come every other week. Felicia does a wonderful job with those, letting you know what's coming up. And if you have events that are coming up, send that to Felicia. Everybody say, send to Felicia.
Send to Felicia.
Send to Felicia.
2 weeks in advance.
2 weeks in advance. Don't try to send it the day of. So send it to her, and they come out on Wednesdays, I believe. Every other Wednesday. And then, of course, we have our interpretations for Spanish residents that Lupita does. She does an awesome job with Spanish residents. She does have some Spanish programming, Spanish language programming here as well. She does some case management. She's an awesome resource in the community. Now I want to open up the floor for, I'm sorry.
Did you want to now?
Ooh!
The biggest one?
What was I thinking? So coming up, September 29th, we have our annual fundraiser, okay? We are so excited to have Anousheh Hossein come. She is a commentator nationally known at CNN, MSNBC, and she is the author of The Pain Gap, How Sexism and Racism in Healthcare Kill Women. You do not want to miss this event, okay? Thank you, Jeff, for being one of our sponsors. We have a number of other sponsors who are helping with this event, but you want to go on ahead and get your tickets now, okay? Get your tickets now. Last year, this event was just about sold out. Yes, and so this year, we're going to have Anousheh. It's going to be at the Grand Wayne Center, 8 a.m. It is a breakfast event. You can get up. One day out of the year, you can get up and get to this event. I'm telling you, you won't want to miss it. We will also be celebrating our 25th anniversary here at Health Visions Midwest. Can you believe that? And so you don't want to miss it. We've got a number of different things in store. And we will be announcing the winner of our Dignity Award, okay, this year. Last year we had some great surprises there with Kai Ada Phi and Yin Yin Mo and her husband winning those awards. This year we've got some other folks who are going to be winning, so you don't want to miss this event. The cutoff for your tickets is going to be a couple of weeks before this, okay? So don't try to wait till the 28th. Okay, we got to know how much to order. All right, anything else, Felicia? Thank you.
No, that's it. Thank you.
Partner news. We want to open up the floor to any of you who may have news that you want to share.
I would, Sharon.
Okay, yes, Miss Yolanda.
Yes, I just want to announce that the Shepherd's Hand will be starting music and cooking classes every Thursday, starting tomorrow, the 24th, through September 28th. The music class is provided by First Steps in Music. Maybe the ladies from the library know Sarah Pultz. She is going to be providing these classes for children ages 0 to 5, and parents and caregivers are able to join. And also the HEAL cooking class starts from 5:30 to 7 the same day. And many of you know the HEAL. I'm new to this, so I'm really excited to be in the kitchen because I love cooking. But yes, and it's going to be bilingual, so I'll be there to interpret. So if Lupita has anybody that she'd like to invite to share this information with, I could send the flyer to you, Sharon, if it's okay, so you could disperse it to everyone.
To Felicia.
Oh, Felicia. Okay.
Yes.
Will do.
Send to Felicia, fsay@hvusa.org.
Got
Yes,
it. Okay.
it will be much safer in her hands.
Thank you so much.
Yes, thank you, Yolanda. Anyone else with an announcement? We have one here in the room. Yes, ma'am.
Do you want this to read it up there?
No, you can just
Stay here? Okay.
Yes, and say your name. And
Okay. Once again, I'm Anna Calamine. This is Megan Bell. We are with the library. We're here to talk today briefly about an exciting author event we have coming up in November. We have Dr. William Cook. He is a doctor based in Austin, Indiana, and he wrote this book called Canary in the Coal Mine. And I'm just going to read a little description about it.
In 2004, Dr. William Cook set up his medical practice in rural Austin, Indiana. At the time, he had no idea how much trouble the town was in. The rampant poverty, addiction, and life-threatening illness soon created two unparalleled healthcare disasters. In 2015, Scott County, Indiana experienced an opioid epidemic and the largest HIV outbreak in rural America's recent history. Dr. Cook decided he had to do something. Canary in the Coal Mine, a forgotten community, a hidden epidemic, and a lone doctor battling for the life, health, and soul of the people offers a look inside the battle he mounted to save this town.
Wow. Okay. Looks like we need to get a book club going for that one. So yes, wonderful. So
we have copies of the book. We have a partnership with the the network of the National Library of Medicine. They've graciously donated a lot of copies to the library. So if you and your organizations would like to hold like a book discussion about the book, read it and discuss it, that would be amazing. Our author event is Saturday, November 4th at 2 p.m. Dr. Cook will be here. And then if you do want to read the book, Meg or I can be made available to hold discussions, but the book actually comes with discussion questions as well. So if you're interested, come see Meg or I, and then we have cards here if you would like us to hold a discussion, or you can contact people virtually. You can contact the library and we can get you copies as well.
So are you saying that you have enough copies for us to have the books? Or
yeah, they donated about 100 copies.
Wow. Okay, let's put our names in. Yeah, we want a book discussion here at Health Visions.
We want a book discussion. We want to put staff down there to help with that.
Oh, wow. Okay. PRC sent staff down there for anybody who didn't hear that online to help with that effort. Anyone else with an announcement that you want to share?
Sheila's got her hand up.
Oh, Sheila. Or is that from before?
Oh, it's the 60th anniversary of the March on Washington. Reverend Bill McGill will be holding an event this Sunday. I'm trying to find the time. I do apologize, just Google it. But it's this Sunday. They'll start at the MLK Bridge and end up at the Courthouse Square. Thank you.
There it is. Oh, there it is. Felicia had to see. That's why you sent stuff to Felicia. She had it on hand right there to share it. So we're sharing that right now. Thank you, Sheila. An important event. And that was in the newspaper. I don't know if y'all read about that, but Bill McGill was in the newspaper there. Anyone else have something you want to share? Before we in-house are starting to eat and
I have
mingle.
a slide with my stuff. Can I show it real quick?
Okay.
Yeah, just got a couple of, I meant to show when I was presenting before, but,
So while she's pulling that up, we in the room will be nibbling on our snacks that you guys online aren't going to get to nibble on.
Darren, don't let them leave without getting a ticket or making a commitment or pledge for a ticket.
Yeah,
we need everybody in this room on this call. You need to buy a ticket. You need to buy 2. Please and thank you.
Yes, thank you. Sheila's on our board, so thank you, Sheila.
Okay, so
all right.
Sorry,
yes, and don't forget to fill out your surveys for those who are in-house. Do the people online fill out surveys?
No, I don't have an online one.
Okay, so for those who are in-house, please fill out your surveys. We need that for our grand tour. Yes, Ms. Colleen?
Okay, so Suicide Prevention Month is September. I should have covered this earlier. We have an awareness raising flyer that would be love to add your logo to and have you send it out. And it's got some important messages like mental health is just as important as physical health. It's okay to not be okay, but you can call or text 988. And here are 5 steps to save a life. So asking and showing up for that person. 988 has a logo down here, and we have it in Spanish, and we're getting our Burmese flyer reviewed and approved as we speak. So we have 3 versions of this. We'd love to give you the Canva link and you add your own logo, or I will do it for you. But please, we'd love to have you send this out in newsletters, on social media. We have 2 free QPR in-person trainings coming up on the 13th and 18th. One is at Anthus and one is at Mental Health America. And then we have our 9th annual candlelight ceremony for suicide loss at the Peggy F. Murphy Community Grief Center on the 7th at 6 p.m. Come honor anyone you've lost to suicide, or if you have a friend or colleague that's lost someone to suicide, please encourage them to attend, and I will get Felicia all the flyers for these things.
Thank you. All right, thank you so much for coming and attending. We will not have an ACHEC meeting in September because all of us will be going to the fundraiser, Rethinking Health, the 25th annual celebration and breakfast fundraiser. So we will see you there. Thanks so much. We will see you September at Rethinking Health. Bye, everybody.
Great job, Sharon.
Okay, thank you, Sheila. I needed that encouragement. Jeff, do you need a pen?